Our residency program was established in 2006 with a deep vision and passion to create an environment where individual graduates could come with a passion and a determination to make a difference in community pharmacy practice. And not only could they do that, but they would be surrounded by leaders, practitioners, and individuals that could work with them to make that vision a reality. Over the next few minutes, you're going to get to meet our preceptors, residents, and some of our alumni who are making a difference in the way that people are cared for in their communities. We invite you to join us to learn a bit more about how you can take your passion and vision and be in a place and an environment that creates that opportunity for you to test out your ideas, to learn some new ones, and to make a difference along the way. So if you have a vision for community pharmacy practice and you want to be a part of a fun and hard-working team, and you envision making a difference throughout your career, we invite you to join us to learn a bit more and to apply to our program. I hope you enjoy meeting our team, and I'll see you at the end of this video journey.
So one thing I personally look for in potential residency candidates is their passion for working in the community. I want someone who has a lot of drive and determination and is ready to be a positive agent for change in community pharmacy practice. We generate a lot of ideas and work on a lot of new projects and initiatives each and every year. So we encourage our residents to be active members of the team, helping us to generate those ideas and be excited and ready to participate.
I'm extremely supported by my PIT preceptors and my Rite Aid preceptors. I'm getting constant feedback, and I feel like I get a text almost every day, just making sure that I'm okay, seeing if there's anything that I need to help me succeed. And I feel like I'm just really being supported and making sure that my career goals are being met, and that I'm not just doing things in a residency program that's not going to help me succeed in what I want to do.
So in terms of what our site offers residents, really would be everything from dispensing, being involved in all clinical aspects of pharmacy, so point of care testing, compliance packaging, medication synchronization, homebound services, 340B, compounding, vaccinations, the list goes on and on.
So part of my career goals are definitely like some sort of leadership position, maybe some sort of clinical position as well. But I think this residency gives you a lot of different experiences, and especially leadership experiences. So we work a lot with management and get exposed to a whole bunch of different aspects that I don't know if we would if I didn't do the residency. So I definitely plan on applying everything I've learned from those experiences towards a leadership position in the future.
I love working with the community pharmacy residents because they have so much practical knowledge of working directly with folks in the community. So they're able, more than any of our other residents, to really know what it's like for that person once they leave our site. They instantly understand our dispensary system and are able to move beyond that to integrating themselves into the clinical practice here at the site.
So at our site, we really fully integrate the residents into our program. We actually have multiple different experiences that we integrate the residents into. Staffing at the primary dispensing site, they are really one of the pharmacists leading clinical programs, coaching the team members on different initiatives that we have going on at the site. Management and leadership, we have them fully integrated into corporate meetings. We eventually want them to get to leading meetings, leading teams, leading initiatives at the chain level. So we really want the residents to play an important role in carrying out our strategy for the pharmacy.
Residents are involved with the National Flip the Pharmacy Practice Transformation Initiative and learn from local and national leaders firsthand on how to implement and sustain innovative community pharmacy services.
I saw the amount of services that they offered to their patients, and just by looking on the website, you can tell that it's a very innovative practice, and that drew me in because I knew that I would have a diverse and well-rounded experience coming out of residency.
I love working with residents. I love to teach and show residents how to run a pharmacy and build relationships with our community.
So the roles of the resident really just vary based on the needs that we have at the site. So the resident can be anything from a coach, a mentor, a preceptor. They can fill in role of kind of dispensing pharmacist, clinical pharmacist. They're a diabetes educator. They're a resource for patients coming into the store, either with medical, clinical, drug information types of questions. So the resident just takes on kind of a whole bunch of different responsibilities. Further on into the residency, they'll also take on a larger management role where they will be involved in specifically coaching other pharmacy teams, other pharmacists, and being truly a resource for the entire company.
Our residents are an integral part of our healthcare team. We have a layered learning model where PGY1 residents will be working collaboratively and seeing patients with a plethora of different types of chronic disease state management with our PGY2 AmCare pharmacy residents and family medicine physician residents. This experience affords the resident to be immersed into the point of medical decision making for the management of the patient's pharmacotherapy.
So one unique experience that I personally precept is our residents' underserved experience at the Allegheny County Health Department Pharmacy. This pharmacy is located in downtown Pittsburgh and is actually in the same building as the health department's pulmonary clinic that services both patients with latent and active tuberculosis. So a disease state that a lot of people don't usually see. Our residents get to have that interprofessional experience in the pulmonary clinic, get to interact with the interprofessional team from diagnosis to all the way through to treatment completion. And I think that that's a pretty unique and cool experience.
Some residents are concerned that they don't have the skill set necessary to successfully complete a research project. But that's what makes our program so great. We surround you with practice-based research experts who can guide you throughout the process, from developing your research question to analyzing your results.
So the residents use the experience from our community-based residency program in many ways throughout their careers. We've had residents take multiple different career paths after finishing the residency program, from teaching to clinical roles within retail pharmacy chains to going into ambulatory care. So I think the direct patient contact, the things they learn dispensing, the management and leadership opportunities gives them great experiences that they can carry throughout their career.
I think the thing that surprised me the most about my residency is just all the welcoming that I've gotten from everybody that I've been involved with. The PIT team's been super helpful. My Rite Aid site preceptors have all been super involved. So just really, it's kind of like a family.
It's great to see you again. So what'd you think? I hope that throughout this video you had an opportunity to be inspired, maybe be intrigued, maybe be surprised, but most of all curious and want to have the opportunity to learn more. We invite you to apply to our program so we have an opportunity to meet you, to learn more about what you see, and to help you to grow and develop into the practitioner and leader that you aspire to be. Thanks for being with us, and we look forward to meeting you.